Good morning, everybody. Today is September 3rd, and it is the Labor Day weekend. And fuck, man, we need it. We need these schools to lock down. The numbers are not looking good. Yesterday's numbers, which represent Thursday's caseload, was 170,000 cases in America. Our average is 165,000 cases a day, and you got to remember when we started back in July, I mean, we were, 50,000 cases, 60,000 cases. I mean, I don't remember exactly now, but, and everyone thought I was crazy when I said, dude, this Delta variant is going to take over and we're going to go over 200,000 cases. And we had 210,000 cases the day before and 170,000 cases yesterday's number. And I think we're going to keep going up. Now, looking back, who remembers last year? Labor Day weekend, we begged people, do not gather if you're going to gather, and our case numbers were coming down, right? And I looked it up. It was around 25,000 cases a day last year. And we were telling people, please don't gather. If you're going to gather, keep it outdoors, keep the numbers like under 4 to 6 people, wear your mask. I mean, there were no vaccines. And then what fucking happens? People gathered, you can't tell me what to do, and we start the increase. Just go back to last September. We were dropping down. Fauci was saying, man, we need to get it below 10,000 heading into the fall season. We didn't know about what was going to happen with the flu. We figured there was going to be a holiday surge, and nope, we got around 25,000. Labor Day weekend happened, and then here it comes. Here's the upstart. So, if last year, if past performance is any predictor of future success, man, I'm telling you, we are heading into the holiday weekend not on a down decline, but on an upcline, and maybe if you're lucky, a plateau. But I can totally see us kind of plateauing around 165 for a little bit, and then a couple of weeks go up again. We might never have this downward trend. We might do exactly what England is doing. All right, the UK. Everyone was talking about, see, the Delta variant burnt out the UK. No, it did not. It went up to 40,000 cases. The highest it's ever been last year was 60,000 cases in the UK. During this Delta surge this summer, it got up to 40,000, came down to 27,000 average a day. People were like, Delta burnt out. Look who's back up to 33,000 cases a day. The 14-week average for UK is 33,000 cases a day and hanging around a plateau. Heading into the holiday season, we're screwed. We are screwed. So let's say we plateau around 160, 165, and we're hanging around like that for 2 weeks, and then we're gonna have. Remember, there's always like a 2-week delay. And then we're going to have the Labor Day, the weekend surge is going to increase. We're going to get into Halloween. We're going to get into Thanksgiving, Christmas. I don't know, man. We just got to get vaccinated a lot faster. And this coincides with schools. We have kids. There are school districts now in Texas. One, Fort Bend, just near me here in Houston. Waco, Texas, which is kind of central Texas. There was a Carrollton School District shut down because two social studies teachers, 6th grade social studies teachers, died within days apart. They died from COVID. So they've shut down to see what's going to happen. Now, let me give you a prediction, Dr. V. I need I need to know what to do. Okay, if you know there's going to be school surge. If you believe me that, we're going to get cases from these schools reopening, colleges, high schools, etc., right? Now, these kids, most of them have parents. And these parents work. Most of them work. And that's why they wanted to open up schools, okay? Well, what do these parents do? A lot of them work, I don't know, let's say hair salons and nail salons, dental offices, right? So these practices that were hurt so bad last year when everything was shut down, and these moms and dads and business owners who had to shut down last year, who might have gone out of business or whatever, I'm telling you guys are going to hear the next thing, which is small businesses coming down with COVID. I'm telling you, if you need your nails done, do it ASAP. Do not wait. If you need your hair done, do it ASAP, or don't do it at all. Like that's why I'm shaving my head. I shaved my head back in April, expecting that it would grow out by 4th of July, our Independence Day. July 4th comes along, I shaved my head again. I was like, dude, I'm not going to the barbershop. So I shaved it again at the beginning of August. I'm just gonna keep shaving my head. So you are going to hear these dental offices, that were shut down last year, and these are high. You got equipment costs, a lot of employees, a lot of techs. Man, there's a lot of overhead. They were shut down for months. They sort of reopened in the spring, and they had PPEs and stuff like that. I am telling you, you are going with these kids in school and these parents who are dental hygienists, who are the front office secretaries, who's the cafeteria worker, waiters, waitresses. You're going to start seeing numbers tick up in these services, okay? So this might be your last chance, man. If you've got to have your nails done, go do it ASAP. If you've got to have your teeth done, if you've got to have a cavity filled, this is the time to do it. Because you're going to start seeing these offices close down, not because there won't be a mandate. The government is not going to shut down the economy. They're going to shut down because they're going to hopefully do the right thing. And they'll have hygienists and doctors and dentists test positive. They'll have to shut down because everyone will be exposed. Now, here's my sneaky warning. They're not all going to shut down. They are not all going to shut down. Now, you might get angry at this, and you might say, see, it's all about the money. It's all about the dollar. Dude, people have to make choices in life. Some people can't take another hit to the revenue. I mean, I went through bankruptcy myself because of Hurricane Ike. So I understand these pressures, man. But I'm telling you, there will be exposures in doctor's offices, dentist offices, restaurants, these goods and services places, these mom and pop stores, and you're not going to know that dental hygienist was exposed, that they had a positive dental hygienist who's at home quarantining, but everybody in that little office was exposed, but they are seeing patients because they're kind of forced to. I promise you. So this has the dominoes start to fall. School closures is just start of it. Man, I'm telling you, university campuses going back to online. We are about to have fucking high school football is this weekend, and college football starts this weekend, and sporting events, professional sporting events, etc. We got to really rethink all of this, everybody. This is really fucked up, man. So, and I know I'll have some haters on here that'll say, Dr. Vuong, you said 200,000 cases a day. We stopped at 165. We stopped at 170. You were wrong. Like, okay, if that's what you think. People are delusional, man. I'm telling y'all. So, all right. That's my dire warning for you. Happy Labor Day weekend. I'll be back again tomorrow with another COVID update. Be safe, everybody. Get vaccinated. And remember, 2 months before you get the most effective protection from vaccination, and that's against the wild type. Still very effective against Delta, but it's the best we've got. It's better than vitamin D. It's better than zinc. Don't even try it. Get vaccinated. Cool?